Okay, this lecture is going to be about American, South Asian, and East Asian patterns of atherosclerosis. Okay, starting out, we're going to talk about the two main patterns of atherosclerosis. The first one is intracranial atherosclerosis. This is the middle cerebral artery. The second pattern is extracranial carotid atherosclerosis. This is the internal carotid artery, goes up to the head. Real quick, let's review the anatomy. Here's the heart. Off the heart comes the biggest blood vessel in the body, the aorta. Then here is the left common carotid artery, and then it bifurcates into the external carotid and internal carotid. Right at bifurcation points like this is like one of the most common locations of atherosclerosis in the human body. The internal carotid artery origin, as well as down here, we've got the yellow stuff is atherosclerotic plaque, and this is in the left coronary artery, left main coronary artery. Those are two of the most common spots to get atherosclerosis. So high-fat diet is characterized by leading to atherosclerosis, especially in the coronary arteries of the heart, like a crown coronary, and in the carotid artery. Whereas hypertension and high sodium diet and diabetes are associated with more intracranial arterial atherosclerosis. And so that's two distinct patterns of atherosclerosis that we're going to talk some more about the details of it. So this, of course, is very high risk of stroke, and this is high risk of stroke as well. This is high risk of myocardial infarction. Now, as far as the standard American diet is the thing eaten by the majority of American persons, it's a very high-fat diet, 40 to 45% fat, and Pritikin had stated there's two main categories of diet, high-fat and low-fat diet. So that's a good general characterization. SFA is for saturated fat. East Asian means China, Korea, Japan in particular. East Asian diet traditionally had lots of rice, and that's one of the big things that protected them. The other thing that was protective was they had a lot of vegetables, even though they ate tons of sodium, over 10 grams a day in many areas, and they smoked a lot. Now, South Asian population primarily means India. There's other countries bundled in with South Asia, but for our purposes of this talk, it's primarily referring to persons from Indian descent. Okay, high omega-6 oils, they fry lots of food, and I think that's one of the biggest problems with Indian diet. Indian food tastes great, but way too much fried food. It's also high in sodium, and it is primarily described as lacto-vegetarian, but so they do have some dairy, so they get some saturated fat, but certainly not as much as the SAD diet. And they tend to be relatively uncommon smokers. I don't know any Indian persons that smoke. Okay, so this is sort of an overview of what we're talking about. The American or westernized diet, standard American diet, very high in saturated fat because they eat lots of meat. Lots of things like pizzas, frozen pizzas. They have some oil, sort of a low to moderate amount. A moderate amount of sodium, about 6 grams a day. Other estimates will give you less than that, but I think it's probably closer to 6. Relatively low in tobacco. Low in fruits and vegetables, and that's an important point. That'll come up again. Moderate to high amount of diabetes. Lots of, like we said, extracranial atherosclerosis, meaning myocardial infarctions, strokes, and impotence. Okay. Now, in the East Asian pattern of eating, like the Japanese, the Koreans, the Chinese traditionally, they eat lots and lots of, we just talked about, lots and lots of rice, fruits, and vegetables, and those are the protective things. But the very high sodium is not protective. And I'm especially referring to Japan and Korea. China is more complex and it's a bigger place like the China study. But there have been some papers about specific areas in China that are similar to Japan and Korea in their dietary and lifestyle patterns. Okay, South Asian persons of Indian descent. They are surprisingly unhealthy because, this was a big surprise to me. Most of the Indians I know are Indian male doctors. They're all skinny. They're all really healthy looking. So I was kind of shocked when I learned about this. But the more I thought about it closely, I'd heard about all these individual Indians having all these atherosclerosis problems, but I always attributed to, well, that's an unusual anomaly, okay? But actually, they have a lot of problems with atherosclerosis, diabetes, and coronary artery disease, and hypertension. And so I'd ask myself, why? I thought they were vegetarians. Well, first of all, they're lacto-vegetarians. They have a lot of milk, dairy products. Secondarily, they fry lots of food, and I think that's the most unique, harmful part of their diet. And so they're also high in sodium. So that right there is another major risk factor for atherosclerosis. So high omega-6 cooking oils, big problem with health. High in sodium, big problem. So they got a tremendously high incidence of diabetes. I gave a previous lecture where I mentioned that I think Dr. Yamashima's theory of beta cell injury due to toxic aldehydes as a metabolic byproduct of omega-6 cooking oils, I think that plays a role, and I would guess probably a major role. I'm not positive about that, but everything points to that from what I could read. Increased incidence of high blood pressure, which tends to cause, like we said, intracranial atherosclerosis, and increased incidence of myocardial infarction, surprisingly high. I don't even know about impotence, but any population that has a lot of diabetes and a lot of myocardial infarction tends to have that and a lot of hypertension. Okay, so what's kind of the key point of all this stuff? The low-fat, low-sodium vegan diet. Very low in sat fat. Zero oil, not one drop. Important point, not one drop. You want to be healthy, you can't just be a half-ass, everything in moderation type of person. People like that never achieve anything. Okay, tobacco, zero. No cigarettes, okay? High fruits and vegetables. They have essentially zero diabetes, zero hypertension, zero myocardial infarction, very low, almost never a stroke, very low impotence. So this is what I'm basically saying is, this is the way to go. You want to win the game of health? This is how you do it. I've been studying this for 30 years, and I can tell you, this is the best you could do. You can dial it up a little bit, 100% organic, whole foods only, things like that. Avoid MSG. So the smart move is to be so healthy that you don't need the healthcare system. That's what you want. Okay, so we'll just go through a couple papers here briefly. Papers on atherosclerosis and diabetes. Pattern of carotid stenosis in Koreans with stroke. Intracranial versus extracranial. Here's the reference. From American Journal of Neuroradiology. Koreans, Chinese, Japanese, more incidence and mortality from stroke. Like I said, that's not all of China. It's specific Chinese populations. More intracranial atherosclerosis occlusions. That's the big point. Okay, because of the hypertension and the high salt diet, they'll have more vascular disease inside the brain, the arteries of the brain, like the middle cerebral artery and its branches. Whereas Caucasians in America eating the high-fat diet, but not smoking as much, they have more extracranial occlusion. So cervical carotid artery and the heart. That's from eating a high-fat diet. They'll also get more stuff in their feet. Well, that's also with diabetes. But just remember, the heart and the carotid artery outside the brain, which are the most common spot that people think of atherosclerosis, that goes with the high-fat diet, high blood cholesterol, for example. Diabetes is a disaster. Diabetes has microvascular disease in the brain, so it causes a lot of strokes, a lot of problems in the eye, blindness. Hypertension also is very damaging to the arteries of the brain. Diabetes also has so-called macrovasculopathy. It causes increased risk everywhere in the heart and in the cervical carotid. Anything that's bad for the eyes is going to be bad for the brain in general, like diabetes and high blood pressure. Another paper here on the racial differences in cerebral vascular disease. It's from 1967. It's going to tell you the same thing. The Japanese pattern of atherosclerosis, more intracranial than the westernized, like persons in Minnesota, more extracranial. So it's a high-fat diet versus the hypertension from smoking and from high sodium. And there's a bunch of papers on that. You'd be surprised. Okay, the other point I'm going to make is, they always initially called and looked for racial differences. Hardly anything is racial. Hardly anything is genetic, by the way. Whenever you see an emigration study, the population that takes on the westernized high-fat diet, they get the same diseases. And then lifestyle things would be things like how much tobacco they smoke, how much alcohol they drink. This is what really causes disease. Hardly anything is genetic. And watch out for the word genetics. It's a dangerous word because as soon as a patient thinks something's genetic, then it's like, oh, not my responsibility. I can do whatever I want. No, most of the time, vascular disease, it's the person's own fault from eating a high-fat diet or doing other bad things, smoking cigarettes and alcohol, things like that. Another paper, large artery intracranial occlusive disease. And this guy's a pretty smart stroke neurologist, and he basically makes out the same point. These Asian populations with the high sodium diet, so they're smoking a lot of cigarettes, they got a lot of intracranial stenoses, whereas the high-fat diet, persons, even who don't smoke much, don't eat excessive sodium, they hardly ever get intracranial atherosclerotic stenoses. They get lots of stuff in their heart and in their cervical carotid, not much intracranial. But eventually, if they keep having all these bad habits, any of them can get any pattern. But I'm just making a point that there are these patterns of atherosclerosis. And the smart thing is avoid all the risk factors. Don't smoke. Don't eat high sodium. Don't drink a lot of alcohol. Okay, but it's just not well known. And because the population is so big in these Asian countries, East Asia, for example, and similar in South Asia, that's the most common cause of atherosclerosis and stroke in the world, is intracranial atherosclerosis, even though hardly anyone is aware of that in the United States. And the other thing is a lot of these old studies are actually better than the modern work being done. The reason is they were done on catheter arteriograms, which are very high resolution, and on autopsy. Whereas nowadays, typical MRA, magnetic resonance arteriogram, it's done on a 1.5 Tesla magnet. That's a standard average magnet. It's not the high-powered 3 Tesla magnets. And it's difficult to see the intracranial arteries. Almost never does anything get called in intracranial arteries. And then even on a CTA, a CAT scan angiogram of the arteries of the brain, you can see a little bit better than on a 1.5 Tesla MRA, but not that much. It's still almost never does anyone call anything in intracranial arteries other than at the base of the skull, the entry points for the carotids and the vertebrals. So the conclusion is we need better medications and devices to treat large artery intracranial occlusive disease. And to me, that's kind of funny. That's a joke of a statement. The reason I'm saying that is, and this is an important point for the audience to understand, these are dietary diseases. There is no medication or surgery that's going to really effectively treat these diseases compared with optimizing your diet. Yeah, there's surgeries and procedures and devices that are beneficial, can help, but the smart thing is just prevent these diseases. They're easy to prevent. Okay, so here's the point here in this little sentence. It's a dietary disease. No pill or surgery can cure that. The author's conclusions were, overall treatment and prevention of large artery intracranial occlusive disease has been unsuccessful. Yeah, right, okay? People stroke left and right, and there's nothing anyone can do for them, okay? Get that through your head. No one is going to save you. Theoretically, you can pull the clot out of their brain, and give you a clot dissolver, and you'll hear stories about that. Yes, that does happen, but that is super rare. By the time people get to the hospital with a stroke, usually they've got extensive dead brain tissue, and there's nothing anyone can do about it, okay? Get that through your head. That's an important point because you have to save yourself. And the good news is it's easy. These diseases, the incidence in low-fat, low-sodium vegans is essentially zero, okay? Here's another paper, intracranial atherosclerosis in Asian population. Same old story, intracranial versus extracranial like we already talked about. Another paper, coronary artery size and disease in United Kingdom, South Asian versus Caucasian men. And guess what? In this particular study, they said there was no difference in the size of the coronaries between the South Asian and the Caucasian men. But they did a lot of stuff to match them. Age, height, BMI, etc. No previous MI or diabetes. So what I'm sort of saying there is I think there might be a small difference because I've heard that in a bunch of other sources, but it's not that big a difference. And don't go saying that's the reason because it's not. Diet is by far the most important thing in coronary artery disease, by far, orders of magnitude by far. Another paper, body fat distribution and insulin resistance in healthy Asian Indians and Caucasians. It's kind of a small study of healthy young people, about averaging around 34 to 35 years of age, and they were skinny. Average BMI is 23 to 24. But the surprise was the Asian Indian population was profoundly insulin resistant. And remember what Pritikin said about Americans. He said, almost every single person in America is diabetic if you just test them at the correct time of day. The point being is, after an overnight fast, most of them, the majority, at least back in those days, the 1980s, would test negative on the oral glucose tolerance test. But you test them in the evening after they've had a high-fat lunch and a high-fat dinner, the vast majority of them would test positive for diabetes, meaning insulin resistance on the oral glucose tolerance test. Oh, now here's the conclusion of the authors. High prevalence of diabetes and coronary artery disease is not explained by traditional risk factors. Yeah, you got to look at these cooking oils. None of these papers will mention cooking oils. By the way, almost all the atherosclerotic papers will have almost the most minimal, no significant mention of diet. So that's why they can never understand anything. It's like, how can you understand atherosclerosis if you don't talk about nutrition? That's what determines if it's caused or not. So also, what I'm trying to hope to show you is you can figure out a lot of this stuff on your own, and just eating the right diet, you prevent all this stuff. Why bother with it? You don't have to bother with it if you're smart enough to fix your diet and avoid it. Okay, some more. Another paper on atherosclerosis and diabetes. Atherosclerosis, cardiovascular disease in South Asians in the United States. And this is from the American Heart Association. And then when it comes from a big association, it's going to be promoting drugs and surgery. You can just guarantee that. And let's see. And the other way, by the way, too, another thing I noticed when I'm looking up all these papers is that, like at sort of like PubMed or something, they won't show you the paper. They won't even show you an abstract. Okay, that's controlling information. That's bad. Okay, I would just go to the journal that actually published it, and I would find a lot of the articles there. But what I'm trying to say is, PubMed is not some unbiased place. It specifically will not let you see things that it doesn't want you to see. And I found the same thing, like when something that a corporation sells, like when I looked up all those papers on creatine, that muscle building bodybuilder supplement, you couldn't, almost all the critical articles, there was no abstract. They're hidden behind a paywall, if you will. You have to pay. And they know that most people won't do that. And it's a way to prevent you from seeing stuff they don't want you to know. They want everybody to be fat and sick. Okay, South Asians, 25% of the world's population, a giant percent. They have increased risk of mortality from atherosclerosis. They had higher coronary artery calcium scans. We talked about that before, but coronary artery calcium scans is mostly for chumps. If you've eaten the Western diet in your adult life, you got atherosclerosis. You don't need to check for a calcification. You don't need to radiate yourself for nothing. The only exception I'd say to that is I've seen some patients, they have no ability whatsoever to understand anything about physiology, pathophysiology, and disease. And I've seen patients like this. And then when they see those calcifications in their heart, they're like, oh my God, I could die. I have to change. So it's like talking to them, it's like going in one ear and out the other, like all this pathophys is a bunch of nonsense. But then when they see that picture, that motivates them. So for some people, I guess it could be useful in that way. But my attitude would be, why give yourself, this unnecessary radiation dose? It's not that much radiation, but it all adds up. And you'll often find incidental omas. That's what you watch out for, where those are going to need follow-up, potentially for years, stress you out, waste your money. Okay, data on stroke on Asian Indians is limited. Asian Indians at angiography had smaller coronaries. So these other studies were showing smaller coronaries. They are more likely to have higher prevalence of multivessel disease, which I think is kind of a funny statement, because if you read the papers of the guy who really knows coronary artery disease, William C. Roberts, everybody who has coronary artery disease has multivessel disease. The so-called single vessel disease is a myth. It's based on underestimation of stenosis at cardiac catheter. Okay, so here's another thing. Oh, here's a funny thing from the American Heart Association. First they say, Asian Indians are more likely to require coronary artery bypass graft surgery. And then just like a paragraph later, they say, Asian Indians have poor outcomes from surgery. Okay, now that is so ignorant. You can totally prevent 100% with Esselstyn's diet, or 99.4%, Journal of Family Practice, July 2014 paper, any recurrent coronary artery events. So, you really need coronary artery bypass, especially when the outcomes are noticeably significantly worse for a patient group. Brilliant. Okay, and then, here's another typical thing you get from these big associations. Some of these differences might be attributable to socioeconomic disparities. Yeah, right. South Asians are much wealthier than the average American. Okay, what's happening? The NHWs are hiding the fruits and vegetables from them. Come on, 2% of the population, 5% of the doctors. Every Indian guy I know, practically, except for a few guys from high school, are doctors. Okay, they're wealthier than the average person. Nobody's hiding fruits and vegetables from them. And then, the American Heart Association. We care about the poor. Yeah, that's right. Why you charge $1 bazillion for open heart surgery. Okay, nutritional truth tellers never come from big places. You'll never see one of the big nutrition true experts telling you the true scoop on things come from a big university or organization, the land of grant money. That's where the grant money is, and the grant money is going to go to drugs and surgery. That's just the way it always is, and it's always going to be that way. And you even look at the guys like Esselstyn. He might have come from the Cleveland Clinic, but they tried to block him from having nutritional consultation option over there. Cornell tried to fire T. Colin Campbell. McDougall never got any referrals other than from family members. People would send their family to him, okay? Their personal friends, but not just a routine patient. No way. So let's see. And none of those guys are in the textbooks. I've gone through all the standard textbooks. None of these guys are in the textbooks. Burkitt for his lymphoma, not for his nutrition. I've never met a single resident who knows anything about any of these guys. And then, yeah, there's an old quote. There's nothing that offends the bishop more than a saint among the priests. Yep. Okay. Anyways, AIs have increased diabetes, at least double the incidence of diabetes. They tend to have high triglycerides, higher prevalence of insulin resistance, higher rates of hypertension. They tend to have eaten less fruits and vegetables. And that's hard to do, eating less fruits and vegetables than the average American. You got to really avoid them. They have more truncal obesity, higher percent total body fat, even at the same body weight. Here was something funny also from the American Heart Association article. They said, the Asian Indian diet has an absence of lean meats. An absence of lean meats, as if that were a good thing. The leanest lean meats you'll see are something like 25% fat or something, which is still terrible. You should never eat that. No meat, not one bite. If you really want to optimize your health, no meat, not one bite. Then the article, of course, talks about a whole bunch of medication options and says, we urge healthy living. Yeah, very scientific. When you can go vegan and just be cured. Okay, well, this is just one more look at the paper. Like we said, South Asian Indians, real high diabetes, hypertension, myocardial infarction, moderate stroke risk. The East Asian, real high stroke risk for all the reasons we talked about. And you can avoid the whole problem just going low-fat vegan. Okay, just a few more words on preventing all this stuff. No oil, not one drop, not any of the oils. I don't care which one it is, none of the oils. And you want to do it before you get damage to your pancreas or your hypothalamic hunger center with these other chemicals that are in processed foods. No meat, not one bite. That includes no dairy. Dairy is just liquid meat. And again, do it before your pancreas and other areas of your body are trashed and irreversible. Esselstyn diet also recommends no sweets, no caffeine. It's been shown by tons of people. It's pretty easy to reverse type 2 diabetes within the first 4 years. It's a dietary disease. It never is reversed by a pill. It's impossible to reverse it by a pill. By definition, it's a chronic disease, unreversible with a pill, okay? That's what chronic disease means, that the patient never gets better. Okay, bariatric surgery can reduce it by dropping the patient's dietary intake. Exercise is a wonderful thing. It activates the GLUT4 glucose transporters within the skeletal muscle cell to go up to the plasma membrane, but it's a totally different mechanism of activation than is that which occurs with insulin. So that's why even somebody who's insulin resistant will get a tremendous benefit from exercise. Eat the fruits and vegetables, get your antioxidants, get your sunshine, lots of starches. Okay, I like organic to avoid those herbicides, which are also worse than these things. Okay, so I just include the references if anybody, the ones I already showed, plus here's some additional ones if anyone's curious. I hope that's helpful.